Hello, I am Aisha.
And Paula, your cultural hybrid mental health therapist.
Here to explore unfiltered and heartfelt conversations on core issues
that affect us as human beings. Get ready for honest, captivating,
and real stories that take you on a journey to navigate your life
in the best possible way.
So grab a seat
and stay with us on this episode of
Do We Have Your Attention? Hi, everyone. Welcome back to the Do We Have Your Attention podcast. My name is Aisha, and with me, as always, is
Paula.
Yes. And for this episode, we have something exciting going on. But before we spill the tea, Paula, do you want to tell them what we're talking about today?
We will be discussing why people avoid therapy. If I had $1 for everyone I've met who has 50 reasons why therapy is not a good thing for them or a good option for them, I would be very, very rich. But okay, but before we dive into today's topic, can we just talk about the fact that we have become full-on content creators?
I didn't realize we're talking about that today.
No, I said I already knew because I was looking at your Instagram. Obviously, I've been looking at your Instagram for the past couple of weeks and I'm just like, I'm so proud of her. I don't know how she's doing it. So I was like, you know what? Let me wait till we're actually discussing topic. We're recording our podcast for me to say, but I love the fact that you've been really diving into this full-time content creator, from your Word of the Week series to my Food for Thought series.
Yeah.
It makes me so proud to see you, to see myself, also just truly coming into our own as mental health educators.
Period.
But obviously on not just in real life, but also on social media as well.
Yes, and I'm proud of you too, and thank you for saying that.
Thank you.
And like you always say, what do you always say?
We are doing boss lady things.
Exactly. Boss lady things, okay? Okay, so I'm excited for our topic today, which is why do people avoid therapy? Not just because we're tired of the stigma around therapy, but also some of the misconceptions around it. And I'm ready for us to really talk about the behind the scenes things that we see personally and professionally around this topic.
Okay, so before we even dive, I know we've been saying before. On a serious note, so today is a big deal. Today's recording is one for the books, one for 10, 20 years from now. I'm like, I remember the first time this happened. So today we actually have our first guest ever on the Do We Have Your Attention podcast. And speaking of boss ladies, I feel like this is a title that describes this person that we have here with us today.
I'm shy a bit.
Real boss lady.
I'm shy.
But yes, let's give a huge welcome to the Do We Have Your Attention podcast space to Funmto Ogunbanwo. Yay!
Yay! Thanks for having me. I'm so honored to be your first guest ever. It's going down in history.
I was speaking with Funmto earlier on, and I did not realize that we forgot to tell her that she's actually our first official guest.
Yes,
so obviously, Aisha has to read your bio. She has to let people know why we consider,
we have to do that?
Why we consider you as well as an actual living proof boss lady.
Yes.
And of course, we would obviously love to check in as well with you to see how you're feeling. But before we do that, Aisha, you have the mic.
Let me clear my throat.
Oh my gosh. I'm shy, please. I'm covering my face.
Please don't be shy. Let's bask in our boss ladiness, okay?
I love that.
Okay.
All right. So today we have Funmto Ogunbanwo, who is a clinical mental health therapist and the founder of DWHYA Therapy and Wellness Limited, which is a mental health private practice offering quality psychotherapy services to those seeking support. She practices from a trauma-focused lens, and her goal with therapy is to provide individuals with a safe, non-judgmental, and collaborative environment that allows for insight, healing of hurt, and discovering the strengths that lie within. I mean, she sounds like a star.
Wow. Dang, that even sounds like a good bio to me. I'm like, let me clap.
Hi, Funto. How are
Hi,
you
Paula.
doing? So I was sharing earlier on that we often do a feelings check-in. And I think this is a good experience for us to obviously use the color wheel, but it's nice to have the three of us be here to actually check in with our feelings using the color wheel.
Yes.
So I will start and then you can follow. So obviously today I am feeling yellow. Jeez, if it's not obvious from my voice by now, I don't know. I am feeling happy, excited, but I'm also feeling, I guess, curious. I don't know if that's the word, where I'm curious to see how this goes, but in an optimistic point of view. So a little bit of yellow, a little bit of pink, a little bit of orange, all the good colors and emotions, basically. How are you feeling today, Funta?
Wow, ditto, same. I'm feeling yellow, orange, and pink. So yellow, happy, positive, in a good mood, slept well. That's always good. And then orange, confident, innovative, just feeling very like on my own stuff, right? And also like I've had really good conversations both today and yesterday. So still basking off of that. And then creativity. I heard you guys applauding yourselves for, being content creators. I'm also doing the same. So I'm just
out.
like, okay,
Love it.
come on. Yeah, I recorded some content earlier and I'm like feeling very proud of
As you
myself. So
should.
yeah, and I'm also just very happy to be here, like 3 therapists walk into a bar or a podcast. So I think it's going to be an interesting conversation, but I'm feeling good overall.
Yes. Thank you for sharing, Funto. We love to have you here today, and we love that you're feeling excited and confident. And just to give you your own special shout out, because the creating content is not easy. So
Yep.
No, it's not.
shout out to all of us for
Good
really
try.
basking
Yes,
in
let's
that.
clap for ourselves.
Yes, but I think I could echo all the feelings that you guys have shared today. As you can all hear, feeling excited, just feeling very happy to record today. Feeling very proud of Paula and I for having our first guest today. And yeah, also feeling very curious to hear, just because we have 3 therapists on the space, for us talking about why people avoid therapy. I'm very curious just from our different experiences. So yes.
Yeah, I love that. I love that. Thank you for sharing, Funta. Thank you for sharing, Aisha. All right, so let's get into it.
Pause. To our listeners, as always, please pause for a second and check in with yourself to see how you're feeling and be honest about it. Like, I know we usually use the typical "I'm fine," but today specifically, we want to encourage you guys to take that moment and really ask yourselves, like, how am I feeling today? Okay? And use the feelings wheel as always. And yes, we could dive into it. Yes.
I am glad that you mentioned that, which is so true, because as we're talking about this conversation, I am pretty sure there is a lot of people who would be like, this is not for me. Yeah, this does not apply to me.
Yeah.
That resistance that often comes up.
Yeah.
I really do implore you to actually be a lot more curious about it and really check in with how you're feeling as you're listening.
Yeah.
So therapy obviously can be life-changing. Now, like you said, Funta, 3 therapists walk into a bar, 3 therapists hop on a podcast. I am so sure that a lot of people go like, of course, this is what you do. This is your job. Of course, you're going to say that.
Yes.
But when I say therapy can be life-changing, I actually come from the lens of someone who was in therapy and is in therapy more from the client's perspective than the actual therapist's perspective. But unfortunately, so many people still hesitate to take that first step when it comes to therapy.
Yeah.
So let's actually talk about why and what we can do to make it less scary or daunting, if there is any way in which we can actually do that. So my first question for you both lovely ladies, mental health educators, therapists, boss ladies, what are some of the most common reasons people avoid therapy? Are these reasons based on misconceptions? Are these reasons based on personal fears? Or are there actually real systemic barriers that make it very difficult for people?
Yeah.
Funta, I'll give you the floor on this one since you're our guest.
Okay. Okay. So I would say it's a combination of all 3 things that you said. There's personal fears, the systemic barriers, and there's lack of understanding, right? So I practice in Lagos. My practice is in Lagos. So I'm going to speak as a therapist that practices in Lagos. But also, I've also practiced in Dallas, so I can speak on that as well.
Yeah.
I would say that being a therapist in Lagos, one of the major reasons why people avoid therapy is there's a lack of understanding. right?
Yeah.
Therapy is still such a very new concept as Nigerians in like the Nigerian healthcare system, right? And oftentimes people are getting their ideas about therapy from media. So either like Hollywood, which we know is a gross misrepresentation of therapy, or social media, right? So there's a lack of understanding. I'm having to do a lot of psychoeducation on just like, okay, what to expect from the therapy process. The people that do come and see us at DWHYA, it's a lot of like, okay, what to expect, you know, people asking like, oh, how many sessions am I going to need? You know, like, is this something that, oh, I just take a pill and then I'm fine? You know, just having to like explain it into like bite-sized information that people can understand. So lack of understanding is one. I would say also there's personal fears in just like fear of opening up and being vulnerable. As Nigerians, we don't really lead with vulnerability, right? It's hard guy. So to now think of a space that is designed to help you be your most vulnerable self, it's just like, nope. I don't want to do it. I don't want to engage with it.
Yeah.
And then, of course, there's systemic barriers such as accessibility. And then specifically with Nigeria, there's a lack of regulation, right? So there are some bodies that exist and, you know, regulate the practice of therapy, but we could have stronger bodies, right? So unfortunately, there's been a lot of like horror stories of people having like their confidentiality being breached and just like a lack of boundaries and just like appropriateness in therapy. So that has now become like the PR of therapy and it's quite unfortunate. So people like myself and like, you know, other therapists in Nigeria were having to just rebrand therapy and letting people know that, hey, quality therapy does exist, you know. So
quality
those are some of the reasons that, that's why we put it there in our bio,
Love
right?
it,
That, you know, quality therapy does exist. It is an option. So yeah, those are just some of the reasons that I feel like people avoid therapy.
Yeah, I 100% agree with everything you said. And I'm literally having flashbacks from growing up in Nigeria and just like Paula and I did our internship back in Nigeria. So we got to like experience what that felt like, just being exposed to what therapy feels like. And yes, that lack of understanding. But I think a lot of people are scared of being vulnerable. And when you do grow up in Nigeria, because of the stigmas, cultural stigmas that are associated with therapy, at least when I was growing up, I used to think that people that were doing therapy were like crazy people or mad people. I mean,
unstable.
There is that, what's that place in Yaba? I didn't get that joke that people be like, yeah, go to
Federal
Yaba left. Yes, the psychiatric hospital.
That everybody
like,
calls Yaba left.
Yes. So I remember being like, oh, like the stigma associated with that, like people actually receiving mental health support was that they're crazy or they're unstable. And yeah, I think if you grow up in that kind of environment where that you're internalizing all that information, it's kind of hard for you to really understand what therapy is, because the cultural collective education is that this is what it is. And if you don't go out of your way to really educate yourself, then you wouldn't really understand what therapy is. And yes, to the systemic issues, the access to affordable therapy. I know therapy is expensive. Even us as therapists, like charging people, sometimes you're like, but this is what I'm worth. But you know that a lot of people cannot really afford it. But like what Funmto was saying, even if the society is not really prioritizing mental health, then there can be really affordable therapy spaces for people to go to. So if it's not prioritized, then you know, there aren't going to be a lot of spaces where we can create affordable places for people to go to and seek therapy.
Yeah, exactly. Like you two, you hit the nail on the head, both of you. And just hearing when you were mentioning understanding, the people don't understand. I think the cool thing here is that at least to some degree, we have some level of experience of working in the mental health sector in Nigeria, but not the way in which you obviously do, Funmto. But to another degree, we have experience of what it's like in working in the mental health sector in the US. So it's also seeing differences, but also the similarities too as well.
Yeah.
And as you were saying, understanding, I actually really thought about it. And I realized that I actually think a lot of people who do come to therapy, even in the US, from my experience, and I'm only just speaking from my experience, oftentimes don't even know what they're signing up for.
No.
Like I almost have to do it's like during the evaluations I have with some clients of mine, there's a couple of minutes in our session where it's like an elevator pitch of what therapy is, what to expect.
Yeah.
And I realized that I have that conversation so many times because people, even though they have the accessibility a lot more here, a lot of people still don't fully understand what exactly should I be signing up for. And you know how it's so funny how you said this notion of taking a pill, or I come, you fix me, and then I leave, and I'm never, everything is fine. It's interesting seeing how some of those similarities do exist in these very drastically different communities. So it also makes you see that besides the fact that obviously there is the personal fears, vulnerability, the actual systemic issues as well that influence it, even just historically, a lot of people don't fully understand and I guess that's why they call it now modern therapy. I know some therapists, they identify now as modern therapists just to make sure that people understand that it's not the traditional therapy that people often were exposed to before.
Yeah. I've had a lot of people come in and just be like, where's the couch that I lay onto? And I'm like, what are you talking about?
Not the couch.
No, you know what's funny? We've actually had people ask us if we have couches. Like someone during a consultation, we were asked like, oh, can you vividly describe the office? And so this is what I mean by like people getting their information from Hollywood, right? Yes. So, the stereotypical like, oh, you're laying on the couch, the therapist is taking notes. That's what people, that's what people have in mind when they think about therapy. Some people rather, I should say.
Agreed. And since we're kind of on the topic of like misconceptions or like myths about therapy, what are some that you both have seen in your work as either clients or just therapists as well? And are there truths to some of these misconceptions?
That's a good question. Yeah. Why I say that's a good question is, are there truths? Just because personally, I'm in this space in my life where I am trying to see every aspect of something. Like see the benefit or obviously the disadvantage of something, and just not going saying, oh, it's a myth, it's not true, but trying to understand if there is some validity to the myth that makes people keep reinforcing said myth. And I think the first one that comes obviously to my mind is this notion that therapy is only for people who are severely mentally ill. And it's not for everyone. It's a thing where it's only exclusive to this type of person. So if you are in therapy, then that means you're automatically categorized as that. And that is so far from true.
Agreed.
At the same time, I do understand why people might feel that way, because ideally, if you're someone who is struggling with severe mental illness, absolutely, therapy should be more of a priority and a necessity versus someone who may not be struggling with mental health issues or mental illness, who just understands that therapy is something that is, it's I don't want to say an accessory, but it's something that you can still prioritize by choice. You can still make it necessary by choice. But it's not something that if you did not have in your life the way in which you have other things on a day-to-day basis that keep you functioning well, you're still okay. Like your quality of life may not be the best, but it would not necessarily be the worst. Versus, let's say, obviously, people who might have severe mental health issues, who go to therapy, who take breaks from therapy, or are not even in therapy, the likelihood that their quality of life will probably decline becomes very high. So it's almost like finding that balance of recognizing that it is accessible to you for your use. You make therapy what it is for you.
Agreed.
If you want to come to therapy to talk about your work. I have a client of mine, or former client of mine, who came into therapy just to talk about this top finance sports job that he had, and just having to work as a leader. So he got promoted. He was a young guy. So he had a lot of people who were disrespecting him in the office dynamic. And that was all we spoke about for maybe a couple of months, to eventually he's like, okay, you know what? I think I'm getting a good sense of improving as a leader. I'm getting more confident in myself. Oh, now I want to talk about my girlfriend. So we sort of just transitioned to something else. But of course, for somebody else, they might come into therapy because they literally just experience a very serious life-threatening event that's inciting a lot of obviously trauma responses, stress responses, and their quality of life has declined. So it's really tailored to the individual itself. But I can also see how that myth to some degree can be validated because obviously if you're someone who is really struggling, you should be prioritizing therapy is a necessity.
Agreed. Yeah, 100% agree. Funmto, what do you think?
I don't think I have anything else to say because Paula said it all. No, that was a really good answer. Something that I also thought about was, again, speaking from the lens of practicing in Nigeria, something that people say is like, oh, my therapist will tell my secrets, right? Going back to what I said about, you know, just people experiencing bad quality therapy, right? And so, again, it's just like helping people understand that while that may have been one experience, right? It doesn't mean that that's the entire experience. And then also helping people take a step back to understand that, like, all over the world where therapy is performed, there are bad therapists.
Yes.
So it's not just exclusive to Nigeria, right? It's not just a thing about Nigerian therapists. It's just that whatever profession it is, there are going to be people that don't follow the guidelines, don't follow the rules, don't follow the ethics. It doesn't mean that we should now then chuck the entire, you know, profession away. It's the same way how people can go to a doctor, right? And they don't feel heard, they don't feel understood. They feel like they're constantly having to advocate for themselves, but we're not going to throw away the entire field of medicine, right? So it's just helping people understand that, like, while that may have been one experience, there are other people. And so with my clients, like when I've seen clients that maybe they've had like a less than ideal experience with therapy, I often applaud their bravery and thank them
for coming
for
back.
even giving therapy, you know, a second shot or a third shot, whatever the case is, right? So just encouraging people that one experience, I mean, what Chimamanda says, right? The danger of a single story. So not just going with the one story or one experience of like, oh, this person was not quality or did not, you know, uphold the boundaries of the ethics, and there are other people as well.
Yeah. Thank you for bringing that up because in my practice as well, I see that a lot where it's actually awkward for us as well because we work in a counseling center. So sometimes maybe a client doesn't necessarily connect with one therapist in our center. And because of that, they're just like, they're never going to try therapy again. But the thing is, therapists, we don't even take it personally, actually.
No, we don't.
Sometimes, yes, it's bad quality therapy, but also it's just sometimes you just don't connect with someone.
It's not a good fit.
And honestly, that's okay. But I think people think, or they expect that when they go there, it's just going to click immediately. And sometimes it just doesn't work like that. Sometimes it does, but for the most part, sometimes I remember one of my friends was like looking into starting therapy and she was just like, oh, I don't know where to start from. And I told her, I was like, girl, just think about it like you're shopping for something that's about to make your life feel better, right? So you have to think more into like, what would you need from this therapist? What would you want? You have to think about race. What do they specialize in? You know, like think about it like this is something that's about to really change your life because that's what therapy is. So you have to really put in effort into it. Don't just go on Psychology Today and just like book an appointment with the first person, right? Right. Like you also have to put in a lot of effort into it because this is something that's important to you. And once she did that, she was like, wow, I found my therapist and like I'm really happy I did that. But I also told her like, even if that didn't work out, that's okay because we could go back to the drawing board and help you find somebody that probably is a better fit.
I have a question about that actually. Like you're making such an excellent point, Aisha. Because a lot of times people will share experiences of being afraid. Just this notion of, let me just, the first person I find, let's just work out so I can start because I don't want to have to go through the emotional process of trying to find the best fit for me. And I know it's very similar to that analogy of if you go shopping, like you said, you're trying on outfits. You don't just pick the first outfit, even if it doesn't fit. You sort of try different ones, different sizes to figure out which one looks the best on you. For you. And of course, if it's, let's say you pick the one that doesn't necessarily, you pick the first size and it doesn't necessarily fit or look the best for you, on you, the likelihood that you might wear it, again, very, very low versus, let's say, if you actually took your time, tried on different sizes, different outfits, you found the one that you really liked, the likelihood that you would repeat that outfit often, very, very high.
Yeah.
But that process, even of looking for sizes or trying to find what fits and what looks good on us, it's exhausting. Let's be real.
I agree. It really is.
Absolutely.
So I have a question about that in terms of where, like, for people who would say that, but that process is so exhausting. Like, I understand what you're saying, Aisha, that I need to really think about my needs and what type of therapist works for me.
Yeah.
But it also means that I'm going to have to really comb through options to find that. What do we say to somebody who might be feeling that way, feeling that level of exhaustion?
Yeah. Okay. I'll go ahead and jump in first. I think this is where you have to take advantage of like resources that exist. And what I mean is a lot of therapists would often have like a free 15-minute consultation, right? So going into that consultation, not just thinking that this is vibes, right? Like going in there on a mission, right? Doing as many consultations with different people that you need to do, right? So just asking the appropriate questions, you know, and even before you get to the point of consultation, like Aisha was saying, do your preliminary research within yourself, like what's important for you. Yeah. And then I also think that it's okay to take breaks.
Agreed.
Right? Because it can be very exhausting, like your question, Paula. You know, it can be very exhausting. So if you are feeling burnt out, if you're feeling stretched, you know, then it's okay to take a break. I would also add that, especially in Nigeria, where like personal referrals are top notch, right? If something works for us, like we see somebody's outfit and we're like, who's your tailor? Right? So if there's somebody that you know that's had like good experiences with a therapist, maybe they work in a therapy practice, right? So there's an increased level of trust that, okay, well, if person X has had a good experience with them or with this practice, then the likelihood that I'm going to have that same experience with said practice is higher. Yeah. So, you know, that can then increase your confidence or, you know, maybe even minimize some of that exhaustion that can come with, you know, just doing the search for therapist. But taking a break if you have to. But being intentional about that break, you know, not just like forgetting it and like, you know, putting it on the shelf and then it's gathering dust. That's what I would say.
Yeah. I think great answer. I think you answered that 100% the way I would have. The only thing that I will add is just remembering the goal, right? So remember, like if you have a pain in your back and you're trying to find a medical doctor to help you with that pain. You're going to do the research to find the best doctor around. You're going to be asking questions. You're going to call hospitals. You're going to do all of these things. Yes, the process is very exhausting. But remembering that pain will not leave until you have that consultation and start meeting with that doctor.
Nice.
So it's the same thing that I think I'm using this analogy for therapy as well, right? You have a goal, and I think it's very brilliant that you're already even aware enough to know that you want therapy. You want to be a better version of yourself, or you just want to work through processing something, right? I think that's very brave and brilliant for that person already in the first place. Don't let the process take you away from your goal, because it, as exhausting as it is, once you start the process, once you get that best fit with that therapist, you'll be so glad and so proud of yourself for not giving up. Yep.
Absolutely. Absolutely.
It's only up from there. But that is so true. You make such an excellent point too as well, focusing on the goal. And just making sure, because that's the truth. If you were going in for back pain, it meant we had to see 10 specialists. We would go to 10 specialists because that pain is so visible, and sometimes mental and emotional pain as human beings, it's so easy to minimize it. Like it's so easy to be in denial about it. It's so easy to justify or say, I can fix myself. I have agency over my own problems. And if I don't, then there's a problem. This pride that we have sometimes in thinking that we only need us, and us to basically address said problems. But you make such an excellent point too as well, Funto, about the personal referrals. As I was listening to you, I just recognized that one of my trajectories in the work that I do is I'm often a therapist to a group of friends. Like, and not necessarily people that are active friends, like in a friend group, but their friend in this state and their friend in that state.
Right.
And they're like, oh, let me tell you about this therapist of mine. And it's just so funny because I remember when it first started happening and I'm like, this is weird. I'm a therapist to college kids and they're all friends. Like, is this? But they were, obviously we had to talk about boundaries, but we didn't even really need to do so much of that because the individualistic reasons why they were coming into therapy was their main focus. So just you saying that is so true because there's a good amount of clients that I have currently where it had to do with maybe their friend was saying something like, oh, you seem a little bit less angry. What's happening?
What's helping?
And then my client will be like, oh, I started seeing my therapist Paula, and they're like,
You see Paula too?
Maybe I'll check it out.
I've been fighting my family and I just don't know. I think I want to maybe improve my relationship with my family. Okay, maybe I would just check it out. And I've seen now a lot of these people for, let's say, maybe over a year, 2 years now.
Nice.
So that word of mouth is so true because if you see someone's outfit that is really nice, you immediately ask, where did you get it from?
Yes.
Where's it from?
Or even something as simple as you see someone going to eat somewhere and the food looks good. You're going to ask, where's this spot?
Where did you go?
That's what I'm always asking.
What did you order?
What is this? Right.
But so now obviously talking about a lot of these challenges that people often have just in that process of even finding a therapist, what would you say are some signs that someone might actually need therapy? Even if they feel as though, yes, like I said, I'm me alone. I am the one that I can fix myself. I don't need anybody.
Yeah.
Even if those are things that they feel and they're doing an okay job, even managing their problems on their own.
Yeah.
If you're going to really break it down, what are some signs that our listeners, as they're hearing this and reflecting on themselves, their loved ones, their partners, whomever, they're going, oh, okay, this is a yes, this is a yes, this is a yes, this
Check,
is a
check,
yes.
check. Well, I think the way I like to think about it is whatever functioning looks like for you, right? So I'm sleeping well normally, I'm eating well normally, I'm connecting with my community, I have a good social life, I'm interested in my hobbies and things that I like to do.
Yeah.
If those things start feeling like a chore or you start losing interest randomly, I usually tell people that this might be a sign that you need to probably work something out in your life, right? Or something's off balance, right? To put that balance back, you probably need to speak to a professional or just reflect a little bit more to identify maybe somewhere in the area of my functioning is a little bit off. And sometimes, of course, those signs, I should say the signs may be different, right? Because there's a severity scale, right? Sometimes it might be mild, sometimes it might be in the middle, and sometimes it might be really severe. So really severe would look like not getting up at all. People haven't spoken to you in 3 days. You're not brushing your teeth. You're not taking a shower. You're not even worried about eating, persistent anxiety. You might be having panic attacks, right? Those might be extreme on the scale.
Yeah.
Middle may look like you're still functioning, but you feel emotional numbness. You feel really burnt out. The things that you normally do, you have to put extra work into doing those things. So I like to take a walk. I'm not going to do that today. And you start to notice that it's going 2-3 weeks. But then one day, maybe someone forces you and then you go, right?
Yeah.
Mild would look like the best functioning ever. And I feel like a lot of people fall in this category where they feel like they're functioning well, everything's good. And like you were saying earlier, people are like, I'm managing well. Like, I'm good. I can still go to work. I can still do all these little things. But those things, they don't feel enjoyable anymore. They feel very, it now feels like a chore. It feels like you're putting extra work into doing those things.
Yeah.
For example, when I knew I was struggling like years back was doing my schoolwork. I couldn't really focus. So concentration, I was eating like once a day. And that's if I even get an appetite. My friends, I think that one was easy because I couldn't really avoid them because they were always present. But I did notice that my presence in those spaces, I wasn't present at all. Like I was just very disconnected from the space. So those are some of the things you may notice in someone where they're just sitting there. They may add one or two, or chip into the conversation. But for a while, you just feel like they're zoned out. Like they're just not present in that space. But I like to hear what you guys think as well.
Yeah, I think you hit the nail on the head. I think you answered perfectly. I would just add to that, like physical symptoms, right? So if you're having like unexplained physical symptoms, if you're having like a constant headache. So in addition to everything that Aisha said, and then you're experiencing physical symptoms like constant headache, changes to your appetite, whether it's increase or decrease, you're not able to sleep through the night, you're restless, maybe even unexplained like stomach issues, right? You just feel uneasy in your stomach. Those are indicators that, okay, maybe something is up and you should probably like seek professional help.
Thank you for bringing that up, because a lot of people will be like, yeah, sometimes people go to the doctors for months, weeks, and they're like, we can't figure out what's going on. And then
it's a panic attack.
The doctor will be like, all right, here is this assessment. How about you do it? And sometimes in my previous practice, people would come and be like, I don't know why they sent me here. This is clearly a medical issue. And I'm like, all right, we'll see about that.
Yeah. I was listening to a podcast recently, another podcast, and on the episode, they were talking about very different topic, but I'll connect it. They were talking about men who deal with, let's say, sexual dysfunction and often the stigma attached to it. So they got a sex educator who specializes in men's health. And one of the things that he said, which I think we would resonate with, he said oftentimes when he meets people and they ask him and they're like, oh, what's your name? And he says, hi, my name is this. So what do you do? This is what I do. Oftentimes, more times than not, he would have a guy just kind of go, oh, I don't need that. I don't need that. That does not apply to me. And as I was listening to it, I just started laughing because, oof.
That's so true.
The number of times where, and then he said something, actually. He said, most times the people who are so quick to react in that way are oftentimes the people who need it the most. And of course, it made me laugh because the number of times when you find people who are often resistant to therapy and often just go, no, that's not me. Oftentimes that's a telltale sign.
Yeah.
Like if there is a serious blocking belief or blocking emotion, or you're having a very out of normal reaction, emotional reaction to what's happening, like to your level of functioning, oftentimes that's a good telltale sign. And if I'm being real with you, I think us human beings, we often know.
We do now.
We know. We just know when we're like, something's not right. Something's off. I need to really pay attention, but not being dismissive of that.
Agreed.
Not just minimizing it or not just seeing it as, oh, okay, yeah, but I'm sure with time things will be fine. Very true. But you can also have quality therapy, like Funmto would say. And of course, in time, everything will still be fine with the addition of quality therapy. So
quality therapy.
Wow. Okay. So I'm glad that we touched on that, because I'm sure a lot of people have probably been wondering. And sometimes, like I was saying earlier, these signs are on a scale. So if it's mild, you may still feel like you're functioning well and you're managing well. Yeah. But it's like we're saying, it's good to just try it out, because like Paula said earlier, it doesn't have to be like a significant mental illness. It could just be, I just want a space to clear my thoughts. I just want a space to kind of have better time management. I just want a space to just talk about what's going on in my life. Because sometimes those things are good too. They don't always have to be bad, right? It could be like, I just want to make sure I have a space that keeps me accountable to be on track. And that's okay. Of course, we can't talk about these signs without talking about how people can support themselves or support a loved one who is hesitant about therapy. Like, what are some compassionate ways that people can encourage themselves or others to consider therapy?
Yeah, I would say with like encouraging, like supporting yourself, I often tell clients and people in general that if you're contemplating therapy, just do it, right? Yeah. Don't wait to the point where it's like, oh, somebody says you urgently need therapy or like you are in a crisis, right? Like Paula said about like a serious mental illness, right? Because I like to use the analogy of like an accident. If somebody has an accident, right, the medical team is going to respond to what is the most critical thing in that moment, right? And then as they're doing that, then they may find out, oh, wait, so there's a history of diabetes or like high blood pressure and stuff like that. And then they now have to treat that stuff, right? So it's kind of the same with like therapy and coming to therapy when you're in crisis. When you're in crisis, we're focused on getting you stable, right? Getting you to that like baseline and regulated. And then we can start to work on the other stuff that's like behind the scenes. Whereas if you came when you were more regulated, or to use Aisha's language, like in that mild zone, we can explore some of those stuff behind the scenes and, really get to do some of the work. So I often say, like, if you're contemplating it, try it, right? And then if you're encouraging somebody to try it, number one, don't throw it as a jab, right? Don't tell somebody in the middle of an argument that you should go to therapy.
Oh my God, people say that a lot. You need therapy.
Don't throw it as a jab. It's not going to be well received. Right. Nobody's going to say, oh yes, I'm going to try the therapy, right? In the middle of an argument. Right. So don't throw it as a jab. Try to lead with your own experience if you can, right? So try to talk about what therapy has done for you, or maybe like done for someone else, and be gentle and compassionate, right? And also like just leave room for them to process that information. So, just give them space to process that information. Let them do whatever it is that they please to do with that information, and just take a step back. And then also don't personalize their reaction. So if you tell somebody in a gentle way that, maybe you should consider therapy, or this is what therapy has done for me, and they become defensive, try not to personalize that defensiveness, right? Because you've just presented information that has existed in that blind spot. And so when we bring blind spot information to the forefront, we don't always respond to it well.
Not at all.
Never. Imagine somebody telling you, your mouth is smelling. You're not going to be laughing, and saying like,
I just love your analogies. I'm crying.
So
I'm just going to admit, I have been very guilty of every single thing you all have listed. And I'm sure in some shape or form, we all have been. And it's good, obviously, being on the other side now, where I have been able to really learn that, one, also coming from me, who's a therapist, is never really received well.
No, it's not.
And in addition to that as well, also recognizing that, honestly speaking, the role that we play in terms of supporting people or even ourselves to get help like therapy is literally just a role.
Agreed.
At the end of the day, people are going to have to make that decision for them. Of course, being a couples therapist, I have this conversation all the time in the sense where it's good. One person may have brought the other person, but if the other person is not in a state of readiness, there's nothing you say or not say about what you think you're seeing in said blind spot that is going to make that person all of a sudden ready. And as I was listening to you, Funto, I just have to share this. I love reality TV shows. Obviously, Aisha knows this because Aisha and myself, we bond with this very heavily. I was having this conversation with someone I don't even remember, but I watched the Kardashians, the show. And years ago, Courtney, who's the oldest, I think was maybe one of the first ones to go to therapy. So she, every time she would walk into a room and let's say Kim sneezed, she'd be like, you need therapy. If somebody said something, and I'm just joking, obviously, when I say that, I just mean, let's say if there were any behaviors that seemed out of the norm, it was just like, this whole family needs therapy. So don't get me wrong. Clearly, the therapy was working
for her.
You could see her making healthier choices for herself. But every time she would bring it up, it was often brought from a place of judgment or criticism.
I'm better
and of
than
course,
y'all.
They would all react. Like it would become a family. It was an ongoing thing for, I think, quite a number of time where there were often seasons where there was just a clash where it's like, okay, why does she think I need therapy, blah, 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 blah. Now, fast forward to, I guess, the most recent season, which I've been watching. I believe Chloe has gone to therapy. Kim has gone to therapy.
Love it.
And I saw there was a scene between Kim and Courtney where Kim was like, I get it now. I get it. I get why you were talking about therapy. But the way in which you said it wasn't really helpful.
It wasn't
so of course,
girl.
I wasn't going to see this as something that's beneficial. So I'm sharing this because this is what not to do.
Yes.
Basically.
Yes.
Instead, a healthier approach in more so doing, I guess, if you have family members, for example, and I'll still use this same sisters. There was a season where Chloe was checking in with Kim. I think after something had happened, like she was a little bit, there was some, I guess, trauma response behaviors from a therapist's perspective where a little bit of dissociation, disconnecting, being very calm in situations where you should be reactive.
Yeah.
And in an episode episode or in a scene, Chloe had just said, do you think that this might be connected to your robbery, the traumatic experience you had in Paris where you got robbed? Very curious, very loving, very much so. I just want to know, like, tell me. And Kim's like, yeah. That you could see in the scene where it was one of those things, and of course we know that not all reality TV show is not full reality, but there was sort of lessons there.
Scripted reality.
Scripted reality. But then, of course, there was lessons there in the sense where you could see the approach, obviously, the other sister had taken versus the approach that this other one took, coming from a gentle, non-defensive, curious place of love. Now that is the approach to actually take.
Right. The approach to take is to not be judgmental, right? Just because like what you're saying is just kind of, the way I'm interpreting it is I can imagine feeling like, oh, I'm better than you all because I'm in therapy. And that's not true, right? Because you were able to take that step for yourself doesn't mean, one, they may have been thinking about it, they just probably weren't ready yet, but that doesn't make you better than them because you made that step. So yes, it's key to identify what not to do. So create a very loving space out of curiosity. I'm always telling people, curiosity is such a toolkit that can bring such closeness and people can be very vulnerable to you if you're just curious. But if you're doing it from a judgmental or from, you have to do this because I did it, then of course people are going to be defensive and not probably kind of rebel against what you're suggesting for them to do. So thank you, girls, for sharing that for our listeners to hear. And as we're wrapping up, I would just like to ask you both to share one thing you want our listeners to take away from the episode, because we've talked about a lot. So if there's something that they could take away from this episode, what would you want them to take away?
It's a good question.
Not the deep sigh.
I know. I'm thinking.
Okay, I really like what you actually just said about curiosity. Curiosity builds intimacy. So if there's people in your life that you feel as though their behaviors is making it difficult for you to connect with them, actually bring in curiosity as opposed to judgment to what they might be going through allows the opportunity for you to actually be a lot more closer to them, because I've not seen situations where people come from a place of not, and this applies to self as well, curiosity with self, curiosity with just your own unhealthy behavioral habits. And I haven't really seen a situation where we take a curious, calm, non-defensive approach and loving approach to ourselves or other people, that there isn't benefit. So you make a very good point. I would say that would be my own takeaway.
What of you, Funmto?
Yeah, I was going to say the same. So in addition to that, I would also just say like open-mindedness, right? I mean, just going back to our earlier conversations about, you know, the misconceptions and the myths that people have around therapy. So just maintaining an open mind, you know, trying and trying and trying again. Back to the analogy that you gave, Aisha, of like a pain, right? If you had a pain in your back, you're going to do everything that you need to do to get that pain resolved. And also, when you find the right doctor, that pain is not going to go away from that first meeting, right? So open-mindedness and setting realistic expectations, in addition to curiosity that was just mentioned.
I love it. Thank you both for sharing. And I will end that with just saying that healing starts with yourself and with community. You don't have to suffer alone, right? Sometimes I know it feels easy for us to say, I know what I'm doing, I can figure it out. It's okay. You don't have to figure it out alone, okay? And that's where I will leave it. And yes, to the best part, where can people find you? Funmto, let's start with you. Where can they find you so that they could seek services from you and EBIO therapy?
Yeah, okay. So if you're looking for me personally, my Instagram page is my name, Funmto, Funmto. If you want to seek services from EBIO, we're on Instagram. So, and also our website. Our website is ibiayo.com. That's ibiayo.com. And then our Instagram is ibii.ay. DWHYA.
Love it.
So that's where you can find us.
And we would also put it in the show notes too as well.
Yes.
So for people to be able to find you.
Yes. Paula, where can they find you for our content?
Come on now.
You can find me at paula.b.martins. And then you can find my practice at The Human Therapist LLC on Instagram, paula.b.martins, LinkedIn, TikTok. Yes. Never, ever, ever will never, ever, ever be X.
Yes. Oh my God.
Abolish X.
Yes. X is out.
How about you, Aisha? How can our listeners find you?
You can find me on Instagram at ab.popoola and TikTok at ab.popoola. And for the podcast, like, where can they find this episode and more episodes to come and previous episodes serve everything?
So you can find us at DWHYA podcast on Instagram, on X,
and YouTube.
On YouTube. And then you can find us at DWHYA podcast 1 on TikTok. Right. And then, of course, if you want to email us, you can find us at info@dwhyapodcast.com.
Right. And so if you found this episode very helpful, share it with a friend or a loved one who might need to hear it. And as always, stay gentle with yourself. And until next time, keep healing and growing. Bye, guys.
Bye.
Bye.